Hi parents, my name is Rebecca. I'm a lactation consultant and today I'm going to talk to you 3 very important breastfeeding tips. You ready? Let's start. So first tips, to start skin to skin as soon as possible after your delivery. Skin to skin means to put your baby on your bare chest without any clothing. Yes, a nappy is okay, but that's all. No matter you deliver by natural deliveries or by cesarean section, you can also discuss with your healthcare provider about early skin to skin. A research done in 2010 shows that moms who did skin to skin within the first 3 hours after their delivery have higher rates of exclusive breastfeeding during their hospital stay. So why is it so important? Because the first few hours after delivery is the most awake time of your little baby during their first day, and it's definitely the best time for them to learn breastfeeding in a very natural environment. And they love your cuddle. It helps them to regulate their temperature, regulate their breathing pattern, and stabilize their blood sugar as well. So skin to skin have a lot of benefit, but it's definitely very important for breastfeeding. Tips number 2, we want to do responsive feeding. So responsive feeding means responding to your baby's feeding cue. So we have 3 level feeding cues. Level number 1, babies start to, stuck their tongue out, turning their head left to right, saying that, I'm a bit hungry, mommy, please feed me. So it's the best time to start feeding. Cue number 2, eating their own hand, eating their clothes, taking the blanket and chewing on the blanket. That's level number 2. Level number 3, oh no, crying very, very loud. Oh, that is a very, very hungry baby. So it might take a while for you to settle your baby first if baby already reached level 3. So responding to your baby is very important. We don't just look at the clock like, it's not time yet, so you're gonna wait, I can't feed you yet. Or like, you don't look hungry, but I feel like I should feed you now. This is only applicable for those babies with medical need. So I'm talking generally, we do responsive feeding. So just like ourselves actually, sometimes in the morning, I don't feel like a big breakfast. I just want a cup of coffee. Sometimes I feel I'm so hungry. I want to eat bread. I want to eat cookies. Sometimes I just want some snack. I want a bar of chocolate. So baby is exactly the same. By responding to your baby can regulate how much they want, and our body will also respond to that stimulation. Just one more note. Responsive feeding doesn't just apply on your baby, it also applies on your body as well. So after your meals comes in, if you feel, I feel very, very engorged, we can also wake baby up to feed. So responsive feeding is a very, very beautiful relationship between us and our baby. Tips number 3, have a good latch. Having a good latch is extremely important for breastfeeding. I'll say over 90% of sore nipple is caused by a shallow latch. So what does it mean? Shallow latch means baby is just nibbling on your nipple. So imagine this is your nipple, this is the baby's mouth. If baby is just nibbling on the nipple, what happened? After the breastfeeding session, you will see your nipple become like a little triangle shape, and you might see some redness over the tip of your nipple. You might feel very painful. Over time, it might crack open and you might see blister on it. So all these are signs of a shallow latch. How can we correct it? It's actually really simple. So we want to put the baby a little bit lower, and we want to position their nose to your nipple. And we want baby to open their mouth wide to take a big mouthful of the breast tissues. In this case, your nipple will be at the back of their throat, and baby will be actually sucking on the alveolar instead of just the nipple tip. So I drew this picture earlier, and I want to show you what does that mean. So we want to position baby in this way, nose pointing to the nipple, using the chin as a contact point, And we wait for baby to open their mouth really, really wide, and baby will be able to take a big mouthful of the breast tissue here. So it's not just this tip, it's this area, the big mouthful of breast tissues. So it might take a few practice. You might want to ask help from your healthcare providers, but remember, having a deep latch is very important for good milk supply and for baby having a full tummy. That's all for today, and thank you for watching. For the next video, I'm going to talk about more of breastfeeding tips. See you!